Okay, so yes, let's start it. Yeah, welcome everyone. Welcome to our, I think it's the third or fourth webinar already, I think number 4 of our series. I'm Catherine, I'm Child Protection Specialist at the Regional Office for West and Central Africa in Dakar, and my focus is on child marriage and FGM. Before I perhaps say a few words about the webinar, let me say thank you for all the presenters that are with us today. You will hear from Mona Ika, who is Child Protection Specialist in the Eastern and Southern Africa region, my counterpart. You will hear from Lauren Whitehead, who's our Social Policy Specialist in HQ. And we, of course, also have a country office colleague, a social policy specialist, Getachew Berhanu Kebede from Addis Ababa. So I'm very excited to welcome those presenters as well. And before we start, I would just like to remind you to please introduce yourself in the chat, just your name, country, organization, if you have not done so already. And I would also please ask all the participants to please mute yourself and turn your videos off because of bandwidth. If you're speaking, of course, you can turn it on and we'd be happy to see you. So maybe very briefly to say that UNICEF in Eastern and Southern Africa and in Central and West Africa, we have commissioned Child Frontiers who are organizing this workshop. And you have seen some of the colleagues like Bertha and Jillian already to design a methodology for developing child marriage strategies for countries and to implement them in 13 countries across both of the regions. And as well as the country studies and the strategy development, the project also involves a learning platform, part of which is this webinar series and a newsletter. So this is really an opportunity to exchange information and knowledge on programming to tackle child marriage. And as I mentioned, apart from this webinar, we have a monthly update, a newsletter. So if you have not done so already, please do sign up. I think Bertha is providing a link in the chat box, and it will take you 2 seconds to fill it in, and then you will receive all the updates we have on resources, any new knowledge coming in, etc. So for today, as I already mentioned, our theme are the linkages between child marriage, poverty, and social protection, which is really exciting. Also noting that social protection is one of the key accelerators we can use towards ending child marriage. And I'm really excited to hear both triple from a global perspective, regional perspective, and country perspective. So we will start off with a presentation by Mona on the experiences and the linkages between social protection and child marriage in Eastern and Southern Africa. Then we have Lauren presenting to give us a global overview on the evidence on social protection as an intervention to address child marriage. And finally, we will also hear from Ethiopia about their experience of successfully approaching to leverage social protection to end child marriage. So it's very exciting. We will also have ample time for discussions. Please start putting all your questions into the chat. But of course, at the end, you can also raise your hand and we will let you speak. And then before I stop myself, just to say the slides will be shared. There will be a Google Drive folder. Bertha will provide the link. And you will also find the recording in there and the recording of past webinars. So I think, and I hope I didn't forget anything, enjoy the webinar. And I'm handing over to Mona. Over.
Thank you very much, Catherine. Hello, everyone. I have already been introduced. My name is Mona, and as I'm setting up the PowerPoint presentation, I'm a child protection specialist for UNICEF East and Southern Africa Regional Office, SRO, as we call it in short. And I'm very pleased to be sharing experiences in this webinar on, and I'll be providing an overview of the work in SR when it comes to ending child marriage and poverty reduction, which of course will touch on the social protection interventions. I hope you can see a full screen. Yes, wonderful. So I wanted to start us off by recalling and reminding all of us, because most of us are child protection practitioners, you know, when it comes to the child protection concerns and financing and, you know, support to households, all the concerns from harmful practices, child marriage, FGM, to justice for children, we all require to invest, right, in these areas. By the investment, not just through a fiscal space, but also investing in the households to alleviate, you know, the struggles that they're facing. I've just put there some of the SDGs, which, you know, we are working towards. There's somebody who is not muted, so kindly, again, as Catherine projected, kindly mute your microphone. So we are in you know, less than a decade to meet the SDGs. How well are we really, you know, on track to support and to advance these areas of work? I wanted to give you some background of the situation of child marriage in East and Southern Africa. And there you can see us, we stand at 32%. And I'm sure some of you from the other regions, you can also refer to that. This is from the study that our data and analytics, the analysis that they did for us, showing the situation of child marriage across the regions. And of course, you know, East and Southern Africa is really amongst one of the highest. We stand second highest from Western Central Africa. If you zoom in to the actual countries with this practice in East and Southern Africa, we again find 2 out of the 10 countries with the highest rates of child marriage, you know, Mozambique, followed by South Sudan. And you can see the rest of the countries and their rates of child marriage. Hence the need for us really to accelerate our efforts in ending this practice. Then the next slide, which is now, you know, setting us into this, the topic of today. What are those, you know, where is this child marriage happening? What are those drivers? And from this analysis, you'll see that child marriage is most prevalent in the poorest households, among those also with little or no education. So that's another second one. And also more prevalent in rural areas. So this is really a cue for us programmers to look at how can we support the poorest households to prevent child marriage? How can we support, you know, households with children, girls who are not enrolled in school, who are not going to school, and of course, leave no one behind, those in the rural settings. Then the next slide, I wanted to just quickly, I'm not going to go into great details there, but just to highlight where the programs are being implemented. So those abbreviations there, starting with the Global Program on Ending Child Marriage, GPECM, followed by the UN Joint Program on the Elimination of FGM, and then the EU Spotlight Initiative for the Africa Regional Program. All these are present in East and Southern Africa, and those projected there are the countries where these programs are being implemented. Child marriage, CM, and of course, FGM. I'm not going to take you through that. I'm sure we can all see. And in the interest of time, let me zoom in directly to the actual strategies. And of course, these strategies we are using for ending child marriage are coming from the, you know, the global program documents on ending child marriage, but also the global and of course per region and per country contextualized theory of change. And here we're looking at about, you know, 5 strategies being used. And my focus today is going to be more on the empowerment angle. You know, the first one there I've highlighted is empowering adolescent girls. The focus, yes, indeed, is on adolescent girls, of those who are at risk or those already married. And how are we empowering these adolescent girls? Many things are happening in this region. Yeah, some are very promising, some are still work in progress that we can improve, but I'll highlight some of those promising practices coming out from the region. So what we see in East and Southern Africa is that child marriage and and social protection in particular, these two areas are very much linked in this region, especially when it comes to address poverty and to reduce child marriage rates. And both these issues, as we know, they are interconnected. As you know, it's very often that child marriage will lead to, a deepened cycle of poverty. It will also impact the lives of the girls and their families. The fact that many girls that go through child marriage will not continue with their education, will not be able to advance themselves further unless, targeted and supported. So efforts, we're recognizing the fact that efforts to tackle these challenges, have to be multifaceted. We have to work with governments, we have to work with partners, CSOs, and even the local communities where these girls are residing. And when it comes to empowerment in particular, in Eastern Southern Africa, we have programs promoting, women's economic empowerment, girls, empowerment, looking, lots of things are happening around vocational training. There are also a lot of microfinance initiatives being supported and rolled out across the countries with which are part of the global programs on ending child marriage. All these are being implemented to provide girls and women with income generating opportunities. And when it comes to social protection, we have existing national social protection programs and initiatives that also play an important role in alleviating poverty, and of course, in return, reducing the rates of child marriage. These programs include, we have programs such as Cash Plus, where the cash transfer is coupled with, or is provided alongside a social service, a support. It could be care, it could be, social services that are provided to the household, and other safety nets that help, vulnerable families meet their basic needs. And I'll also mention that, I'm going to zoom in with some examples so that you see what exactly is happening, but at least, where these programs are being implemented, we are seeing some progress. And some countries have actually evaluated their Cash Plus programs, and we have seen the gains that are there when it comes to ending child marriage. So I'll start off with Zambia. Zambia is having several ongoing interventions. They're building strong synergies between community case management and, of course, the referrals, and making sure that the adolescent girls who are at high risk of child marriage are linked to access the social cash transfer that is there, the program that is there in Zambia. And also, Zambia has synchronized the case management information system, the data source, with the social cash transfer system. This really helps to track the families with children at risk of child marriage, and of course target the cash transfer programs to these vulnerable families. Zambia is also strengthening linkages between keeping the girls in schools and case management. Case management, you're going to hear this a lot, but this is the aspect of the service being provided alongside the cash transfer. So the case management and women empowerment or livelihood programs, these are the areas that are being provided alongside with the community case management for prevention and protection of the adolescent girls. Zambia is also strengthening access to constituency development funds for girls, such as bursaries for boarding schools, and also enabling the families to access empowerment funds for economic strengthening. And also lastly, Zambia, when it comes to the community case management, is actually an integrated, case management. It touches upon with the other sectors alongside, the main sector responsible for children and women. And of course, the social cash transfer with a 1,000 days pilot for targeting pregnant adolescent girls or teen mothers with GBV, nutrition, sexual health rights services. So you can see there are multiple, the care part, the social welfare part, alongside the cash transfer, targeted to this household, to the adolescent girl, to really help and enable the child to thrive, regardless of her situation, to prevent child marriage, but for those already in marriage or those already pregnant, to continue to receive their rights when it comes to development. The other example I'm going to give, and of course we'll hear more details from Ethiopia, but we have Uganda. Uganda, again, the focus is on the adolescent girls, and they are looking at structured life skills training rollout using innovative life skills toolkit, including entrepreneurial upshift program for in and out of adolescent girls and boys. I think the argument is always there, the debate about, oh, you're only focusing on the girls and not the boys. We should have an inclusive, program. But we're starting to see that the focus may be on the girls, but in certain countries, boys are also included in these initiatives. And there's a lot of write-up on the Upshift program, and I encourage you to take a look for more details to find out how that works. And also, we have in Uganda a community-based empowerment program, again targeting the adolescent girls, using the UNICEF, the UN definition of 10 to 19-year-olds who are at risk of child marriage or who are pregnant, already married, divorced. That's also, we're looking into that, widowed, or using the community models that are in place. We have the SASA. I'm sure many of you have heard about SASA, a great program, initiative, evaluated, is showing that it's working. It involves, male engagement to prevent GBV. It's also about parenting practices and many other great initiatives and strategies being rolled out. We also have, through these community models, we have the sexual reproductive health rights services and linkages to social protection programs. So you may have, in this country, they have existing models, but alongside the implementation of these community models, linkages or referrals are also made to the social protection program. When it comes to access to services, again, Uganda is looking at social health policy, looking again, focusing on the adolescent girl, seeing how, this implementation of structured, health services can really be extended to empower also the girl child. Again, social norms change. I think somebody else is speaking. Social norms change and gender transformation is also another important area in Uganda, where implementation of gender transformative approaches are being rolled out, including male engagement strategies, and all these are just abbreviation of existing initiatives in Uganda to empower, to support adolescent girls, women, and the community overall. Of course, multi-sectoral partnership engagement and implementation of national strategies on ending child marriage and looking at teenage pregnancies. Uganda has, was one of the countries in our region at the onset of the pandemic, where they closed their schools for 2 whole years. And you can imagine what happens to the adolescent girls, to the children overall, to the families, the economic aspects of, the family, the household. A lot of things were not going right. But in response, and also in an effort to prevent, future recurrence, there were a lot of teenage pregnancies observed or recorded, the highest that the country has ever recorded in any given year or 2 years. And as a result, the government committed and rolled out a nationwide campaign to end teenage pregnancy, and child marriage. They also had a lot of go back to school campaign, build back better, and also some initiatives pertaining to peer-to-peer support. And lastly, Uganda also supported the rollout of a national school re-entry guidelines and other related materials, especially to allow to facilitate the girl child to go back and back to the education system and learn from it. This is really my last slide. I want to conclude just to give you some of our lessons that we have learned overall when it comes to ending child marriage and social protection. Overall, I would say that addressing all these, multidimensional aspects of poverty and promotion of long-term development of these traditional cash transfer programs with other intervention or support services, it really requires us to complement or to add complementary services along with this with this cash transfer. We have seen, education being a very key intervention for the prevention of child marriage, being very important. And not all countries may have education for all or free education, education without any fees. Even when the fees are not there, there are other costs that families have to foot or to pay. So how are we supporting the households and empowering the households with girls at risk of child marriage or already those in marriage to really be able to take care of themselves and their children in particular. So when it comes to the aspect of education, it's extremely important. We're seeing that, when the cash transfer is coupled with a support service, whether it's a social service, a case management, just understanding the situation of the household, then we get children being enrolled in schools and continuing to stay in school until they finish the school years and advance to the next level. We are also seeing that when these two things are combined, the cash and the plus or the support services, we also have seen gender empowerment. And this is extremely important because we've seen cash plus programs, can actually be designed to address gender-specific issues and empower women. So, for example, the cash payments are made to female household members or promoting women's participation in education and decision-making. That's another, another aspect that helps us to have this gender empowerment, and we're seeing this on the ground. We are also seeing other gains, the example I gave earlier from Zambia and also Uganda, where health and nutrition improvements are being observed just because there are some cash plus programs that include education, they include nutrition, they include healthcare support, and all this leads to improved health outcomes for those households that are targeted. And I'll also say when it comes to resilience and coping mechanisms, we've seen also some gains there, especially now in a time where the world, the region, and the rest of the world, we're all living in times of multiple crises that are interconnected, that are simultaneous, that have a heavy, they take a heavy toll on the family, on the household. And we've seen this cash transfer plus care can actually act as a safety net during times of a crisis or shocks. And this again, in return, enables the household to better cope with the emergencies and really be able to, I can hear someone's dog, resilience. And lastly, to conclude, I will say that, the effectiveness of cash plus programs, all this depends on how the cash plus has been designed. How are you, what criteria is being set? We've also observed in this region, some of the gains I've mentioned are actually unintended consequences of the social protection program. it wasn't designed with the view of, preventing child marriage or prevention of teenage pregnancies. But as a consequences, when the well-being of the family was being, received or empowered, the family was being empowered and their well-being improved, as a result, the families will not marry off their children. Teenage, girls will continue with their education and prevent, pregnancies and so forth. So even though I mentioned unintended, but it was a very welcome consequence. So when, and this is to UNICEF in particular, my colleagues in child protection, when our social protection colleagues are having their meetings with their partners, it's important for us to build that relationship with them. When they are in the process of designing a social protection program, submitting a proposal, let's say, for example, most recently to the World Bank, how are we also contributing and putting our criteria, trying to negotiate and advocate for social policy folks to see the need to include this as one of the criteria in setting up these social protection program, this cash plus. The plus part is really up to us and the government to further define. So program design is important, but also most importantly, the implementation, the monitoring and the evaluation, extremely important. I'll conclude by giving the example of Mozambique, where there's a very good social protection program being rolled out, and also now it has been scaled up to other provinces. And initially when the program was designed, it wasn't aiming for, the prevention of child marriage, the prevention of violence in the household, but these were the consequences of the program being implemented. In the course of the evaluation, this was, well documented and informed the design of the continuation or the next phase of the program, of the Cash Plus program. And as a result, households with children at risk of child marriage, adolescents in particular, are being targeted and being supported. So that's why it's important for us, as we continue with our work, to be very close to the social policy folks, to understand, the programs in the country and to see what opportunities you may have to advance the plus part, the care part of the cash transfer, so that households can benefit. So with that, I'm going to stop there, and I thank you and would like to pass the floor over to Lauren to give us the global overview. Thank you.
Amazing. Thank you so much, Mona. I'm not sure, colleagues, do you want me to go ahead and jump right in, or did you want to do a transition or say anything as a result of Mona's amazing presentation?
Thank you, Mona, and thank you, Lauren. I think it makes sense for you just to jump right in, Lauren, and we can then maximize our time for questions and discussion afterward. Thank you.
Okay, amazing, amazing. I was actually going to say, Mona, I think you already did the job for me. You've already made a very, very clear case for social protection and essentially how social protection can address some of the key drivers of child marriage. So I do honestly feel like that was fantastic. So thank you very much for that. And actually, I will use that to jump through some of the elements of my presentation, hopefully a little bit more quickly, so we have the chance to, more quickly than I intended, so that we have the chance to get to questions and answers. Thanks to Mona now covering some key areas that I was going to mention. So colleagues, just to reintroduce myself to those who I might not be familiar with. My name is Lauren Whitehead, and I am the Social Protection and Gender Lead for the Social Policy and Social Protection team. And I'm based at UNICEF in New York at HQ. And so very happy to be invited to be a part of this presentation, and very happy to see some familiar faces again from the retreat for the global program. Just very glad to see that this will be a key area of work going forward in this third phase. So without further ado, I'll go ahead and jump right in. And actually what I'm going to start with, if everyone is comfortable with this, is just a very quick survey question for everyone. And if you give me just 1 second, I will start that. Okay. So that should be started for colleagues. And so I will switch screens in a second so we can see what the responses are. But all you need to do is go to slido.com, which you see written on the screen there, slido.com, and you enter in the hashtag space end CM for end child marriage, of course. So you just go to slido.com and you enter end CM, or you can also hold your mobile phone up to the screen and scan the QR code that you see there. And this will take you right to the Slido to answer the question. And if you can just keep that open, because we have just a few questions that I'll ask you via Slido, that would be fantastic. This first question is, which of the following are examples of social protection? Again, the question is, which of the following are examples of social protection? And I'm going to switch my share screen now so you'll be able to actually see what others are responding, as well as what the options are there that you should currently see. So again, that's which of the following are examples of social protection? And then just share. Okay, so hopefully we have colleagues who are able to click in. Please do let me know if for some reason you're not able to join. And I'm very happy to share this in a different format for everyone. I think we might have someone else who's joining us. Okay, great. So again, you just go to slido.com and you enter end CM, or you can scan the QR code that's on the screen. I see in the background here, I see that we have just one colleague so far who's been able to log on, but I see we have 50 people today. So I know that we can get a few more answers. This helps to set the scene for what social protection is. And all of the responses there that you'll see as options are in both English and in French. So let me see if I can share my screen here. Let's see. Okay, we have another brave colleague who's joined us. Hopefully you can now see the screen for the Slido question. And I'll just read the options aloud. But again, you can go to slido.com and enter end CM, and it should give you all of these same options here. So which are examples of social protection? You can choose all of the answers that you think apply. Some of the options include child benefits, care policies, health services, retirement pensions, social service workforce, jobs and livelihoods, school vouchers, and water and sanitation services. So those are just some of the options there. And maybe I'll just give it one more second to see if we get one more colleague to come through and answer which do you think are examples of social protection. Okay, all right, so right now it looks like the leading answers, and please feel free to keep responding. The leading answers people seem to be choosing are child benefits and care policies, okay, followed by health services and jobs and livelihoods, school vouchers, okay. So again, okay, we see a large number of people. Okay, great, I see more people have joined, fantastic. So we see more people are saying child benefits and care policies. Wonderful, and thank you, Bertha, for dropping the link in the chat for everyone there. Very appreciated. Okay, terrific, terrific. Okay, so I see a number of people who are saying child benefits and care policies. Those are still the highest two voted, followed by health services, followed by jobs and livelihoods. Okay, fantastic. And now that we have 10 people at least, that's very good. So we have at least 20% of the room who's voted here, and we're still keeping those top two as the top voted options: child benefits, care policy, followed by health services, and now social service workforce and jobs and livelihoods and school vouchers. Okay, and we're going to answer those questions. I'm going to give the answers to those questions in just a second, but this is good because this gives me a sense of where people's understanding is on social protection, and also gives you some examples of things that have been potentially, I'll tell you whether or not, considered part of social protection. Now, stay in the Slido if you don't mind, please. That's wonderful. Great. I see more people are coming in to answer. Fantastic. I'm going to just take us to the next question, which you should see in the same Slido. You don't have to change to any new code. So the next question should appear now. Okay, And this is a live quiz question, which let's see, it should show you already. Okay. Oh, I think I have to read the question out loud and then, yes, that's what it is. So the question here is, who is social protection for? Who is social protection for? That's the question. And it's great that we have people entering their names. It's actually funny. It should be giving you options here to say who we think social protection is for, but I don't want to lose any time if it's not doing that there. Yes, let's see if I can view the leaderboard. Interestingly,
it is asking us to type our names. Sorry.
it's asking to type your names. Okay, I'm not sure why it's doing that, but that's okay. So I'll just get to that as I go through the questions. But if you'd like to, you can feel free to type here who social protection is for. And I'll just say what the options were. The options are, is social protection for children? Is social protection for older people? Is social protection for women? Or is social protection for everyone? So those were meant to be the options. I'm not sure why they're not showing, sorry. But so that is the question, who is social protection for? And I'm very curious as to why it's asking you all to enter your names, I'm sorry. But that's okay, I will continue on. And I see that there is one answer there, thank you. Social protection is for everyone. And we'll also come back to the answer to that question, but fantastic. So thank you very much for everyone who jumped in. Okay, I see. For all of the world, for everyone. Okay, fantastic. Thank you for answering that as well in French. And I'm sorry about that because I had everything nicely translated to French and everything, but I'm sorry it didn't come through. Okay, so I'm going to just take us right back to the presentation. This is fantastic. Thank you very much to everyone for participating in those first two questions. There'll be one more question as well at the end of the presentation, so please do look out for that. I'm just going to reshare the slides there. So you should be able to see my slides again, and do let me know if you cannot. Yes, it looks like I am. Okay. And you should be able to see them in full screen mode. So do let me know if you can't see that. That seems great. Okay, so the second question, which was there, is who is social protection for? And so I'm going to answer both of these two questions for you right now as we go through. And those of you who may have been a part of the Johannesburg retreat for the global program may be familiar with this. And if not, for those who are new, I hope this is very useful information for everyone. So to set the scene, starting in the beginning, and I do apologize that my slides are predominantly in English, but I did try to translate the titles at least in French, so it would be a little bit easier for colleagues to follow along in sequence. So to start setting the scene, I wanted to frame this with your understanding of exactly how social protection matches up to some key drivers of child marriage, or how it can address some key drivers of child marriage. As I mentioned before, Mona did a fantastic job of actually speaking to this in her presentation. So I will just highlight from here a few critical points. Those top two areas you see on the left-hand side of the screen as drivers of child marriage are critical, because social protection is predominantly a strong response to poverty, to lead to poverty reduction for families, but it can also be a strong response to gender inequality when it's designed to be gender responsive or gender transformative. And I think Mona said this very well. If the design is not intentional, there may be some impacts from social protection more naturally or organically on child marriage, but they won't be as impactful and they won't be as specific as when that design is intended to, for example, reduce gender inequalities. Similarly to what Mona said, social protection can help address issues around lack of access to education. It can help address some issues around insecurity and crises where it exists and where it's in place, which I know is a key issue for the region. It can also help address cultural norms and issues around, of course, wealth inequity. And the ways in which social protection does that is what you see on the right-hand side of the screen. So through things such as economic empowerment, social behavior change, reducing gender-based violence, covering girls' education costs, and even jobs and livelihoods for parents. So some of those options that you just saw in the quiz, you do see appear here, that social protection does have elements of things such as jobs and livelihoods for parents, for example, and we'll talk about a few more. But this is the general idea of this slide, and I'll continue as I know Mona spoke to some of these points. So when we think about the universe of social transfers that you tend to see within social protection, it's very important to identify that there are different features of social transfers that are available, meaning that social protection programs are not all the same in every country, and they do take very different forms depending on the country context. So for example, social transfers can be considered to be universal for an entire population or entire segment of that population. For example, universal child benefits for all children under the age of 2. Or social protection programs and policies can be targeted, meaning that they can be targeted just to a specific group, for example, people living in poverty. So when I asked that question before, who is social protection intended for? Social protection is a right for all people. So the answer there is actually everyone. Everyone has a right to benefits of social protection, and I'll talk about more as to why. But specifically, there are sometimes certain populations that are targeted with certain aspects of social protection, whether that's children or that's women or that's older age populations or et cetera, other vulnerable groups. That does happen in some contexts, especially on the continent, given the constrained fiscal environment in which some governments operate within. Social protection can also be cash. And social transfers, can be cash, but they can also be in kind. So it can be providing school books and school resources, et cetera, to households that are unable to access those. It can be providing food supplements to households where markets are distorted and cash alone wouldn't be sufficient, for example. And we'll talk a bit more about cash plus, but there are different kinds of social transfers. So it's not all cash, but it is in many cases predominantly cash on the continent. And then social protection can be both conditional or unconditional. So social transfers can be open. That means that any population that qualifies can access them, or there can be specific conditions or terms that households have to meet in order to access them. Now, very often, social protection, especially when we're thinking about applying it to child marriage, there is an instinct to apply conditions, to say a household can only access the social transfer if they do A, B, and C, if their girls are in school, if their children receive health services, if these kinds of things. However, one word of caution on conditions is that although conditions may produce some of the intended outcomes, for example, helping to lower child marriage by keeping girls in school, conditions actually can penalize the most vulnerable. So the households that have the most difficulty in meeting conditions in different contexts are almost always the poorest and the extreme poor households who have other constraints that make it difficult to meet the conditions. So if you tell a household they will only receive these benefits if they do certain activities, but then it's difficult for them to do those activities, then you end up in a very similar place where you've actually penalize those households even more for their poverty in many cases, or for their vulnerability. For example, maybe they aren't sending their girls to school because there are barriers to access schools. There aren't available schools in their area. There isn't sufficient transport, safe transport for girls to be able to get to school, things of this nature. So you do have to be very mindful of that. It can also be very costly to monitor conditions. And we've found that in contexts, especially where there are high degrees of poverty, for example, let's take a country like Madagascar, let's take a country from West Africa. Let's think of Liberia, for example, where you might think of a country where there's very, very high degrees of poverty in that particular context. Adding additional conditions is going to make it more costly to monitor that program. Whereas if you didn't have those conditions and you know there's a set of constraints facing a very poor community, for example, you can apply a particular response to support that community in fulfilling exactly what you're hoping they would do. Send their girls to school, for example, without having to apply a condition, by actually facilitating that process for them, especially in extremely poor communities. One last thing just to mention here on a caution is that there are alternatives to conditions that can be applied. You can have nudges, which our SBC colleagues would be very familiar with, but nudges are a means by which you can encourage people to take up a certain behavior or activity without making it punitive if they don't. You can leverage other forms of SBC. You can have messaging around the importance of girls' education or the importance of not marrying off our girls. You can also have labeling, which has been proven in a number of RCTs to be very, very strong, meaning that you say, this is a transfer so that your girl can go to school. And even without a condition, you see much higher rates of households complying. And you can also have contracts and pacts with the household that say, if you are participating in this program, these are the expectations of being a part of this program, etc. Again, all alternatives to conditions that can still help reduce some of the same impacts. And we'll speak later about some of the plus components that can be added to especially cash transfer programs. So there are a few things that it's important to note that cash can and cannot necessarily do, some things that are not automatic benefits of cash. So some of the things that cash can't do is what you see there at the top. So cash provided through social protection programs is never going to reach households that are not registered. So if a household is not registered for social protection program, it's not going to necessarily be that benefit that's going to drive outcomes related to child marriage. It is also important to note that many social protection programs don't always have rolling enrollment in those programs or dynamic enrollment, meaning that there are specific times of the year or specific times even every few years where a recertification process happens to enter households into that social protection program. In between those times, there are other things that UNICEF, UNFPA, and partners can do to help supplement and provide access for households so that they can then be enrolled in the social protection programming when that registration opens up. But that's important to note. It's not dynamic and on demand in many countries. And so there is a bit of a process and there are windows for enrollment of households to be aware of. Doesn't always have case management, as Mona mentioned. Many programs sometimes want to give cash directly to children, and through social protection programs, you're not necessarily going to be able to do that. It will often go to the adult as being the minor, as being the adult in the household, for example, the household head, or some programs that are targeted directly to women, but it can be harder to get those transfers in the hands of, for example, adolescent girls through social protection programs, unless there is a specific provision for that. For example, if they are the head of their own child-headed household in some cases, things like this. And it's not going to solve all of the problems. So it is important to note that cash can't necessarily do everything, but there are a number of things that it can do. And I think some of you on the call are probably very familiar with this. It can help reduce a household's monetary poverty, which may be the reason why they're pressured to have their girl engage in child marriage, especially in the world of polycrises that we face now. Households are confronted with many difficult decisions, and sometimes child marriage is a last resort for them because of monetary poverty. So it can absolutely address that. It can be used to target families of at-risk girls. We've seen examples, for instance, in Ghana, where they've used the Integrated Social Services Program, ISS, in order to actually target girls who might be at risk for social protection. And that's a collaboration between child protection and social protection to do that. It can lower GBV risks and help balance control of household financing. It can also help households link to jobs and labor for greater stability. And it's most impactful if it's longer term and sufficient to meet a household's living costs. So these are just some of the things that cash can and also cannot necessarily do. Going to the next slide here. So just to say, in that question that I asked everyone in the beginning in Slido, what are some elements of social protection? Many of the things that people selected are very true. Social protection, one of the number one things people know is cash transfers, cash benefits. That is absolutely true. Those are a key part of social assistance through social protection. And that is one of the key foundations. But as you see in the graphic on the left here, there are other elements of social protection as well. Care policies is another remit of social protection, especially because those care policies address the needs of households at vulnerable periods of their lives, when someone is pregnant and lactating, when there's a new child in the household, for example, protecting someone's job protections in the case of pregnancy, and even parental leave. So for both men and women, those care policies that are enacted are all parts of social protection, or can all be part of social protection. But what you see in this list here are some of the many other areas that people are less familiar with that are also part of social protection, including social insurance. So I did trick you a bit there. Social protection doesn't provide health services. That's provided from the healthcare sector, from the health sector. but social protection does provide health insurance. So many times you will see national insurance schemes for access to health services. That's what social protection does. In many ways, social protection opens the door and access to many things. It gives a household the right to access national health insurance, and then the services themselves are provided by the healthcare sector. So that's a form of social insurance. Another form of social insurance is pensions. Many people did not choose this in the options that were there, but retirement pensions are social protection. That is fully part of social protection. It's a key area of social security and social insurance within social protection. The social service workforce, including that which provides case management, is also an element of social protection. And then, of course, is an element within child protection and other areas too. But social workers are a key component of many social protection systems. And then labor and jobs, which I did see that someone selected correctly as well there too. Social protection does help provide access to labor and jobs, especially for those who may have difficulty accessing labor and jobs. So that can be job training programs, that can be on-job placement, can be vocational training, even for out-of-school youth or of age, etc. These are some of the other areas that you can access in social protection. So social registries to identify households. You can also access the delivery of social services, including but not limited to cash, and linkages to other sectors, linkages to health, for example, linkages to education, etc. All of these tend to come through social protection in one way or another, as well as cash plus programs and humanitarian cash. But it's important to note, a system in crisis is only as good as that system was before crisis. So in countries where there are weaker social protection systems, there's not going to be as much that you can do and leverage through social protection. So it's important, especially for all colleagues who are in child protection here, to work closely with social protection colleagues and understand what the benefits and the limitations of a social protection system is in a certain country or context. In West Africa in particular, social protection systems tend to be a bit less developed than what you would see in East and Southern Africa, for example, because social protection systems and programs are newer in West and Central Africa. So even in those cases, it's especially important to align with social protection colleagues to really understand what the system can do, what it's well placed to do, and where you might have to supplement what that system is not able to do. So again, program in crisis is only as good as that program before a crisis strikes, which means, which means that if that program is not well established and then a major crisis strikes, a climate shock, a conflict shock, COVID-19, the system can respond as well as it was equipped to respond before the crisis. On this slide, I'll just mention very quickly, what are some of the benefits of leveraging social protection? One key benefit is scale. So social protection currently covers almost half of the world. So about 47% of the world is covered by social protection benefit. But it's important to note, as UNICEF and ILO have recently come out with a report that shows 1.5 billion children still are not covered by social protection. So if you narrow this from looking at the whole world to looking at children, about 25% of children are covered. And even though about 47% of the world is actually covered by social protection programs. And then another reason to think about social protection and scale is that nearly $800 billion were spent on social protection programs globally in 2021, and that number is rising as we see now, and as we saw during COVID-19. So social protection programs are increasingly having higher and higher investments because the benefits are really seen. So these are programs that are growing and can be leveraged. What are some of the benefits, again, of leveraging social protection? I won't mention all of these because you'll have access to the slides, but scale, like I just mentioned, especially in reaching rural populations, targeting, using social registries, for example, targeting both married and unmarried girls. So one area I know that the global program is looking to expand in is what do we do with girls who are already married? For example, social protection is one way of reaching those girl-headed households that are already married, for example, or just girls that are in marriages, even if they're not the head of household. Social service delivery, so integrating with other services, other sectors like health and education. It can be a part of shock response and humanitarian contexts and crisis contexts. And of course, cash plus, as Mona mentioned. So you can take social protection programs and interventions and leverage social service workforce to have case management. You can also leverage cash plus through providing information, SPC, nutrition, health, SRH, skills, livelihoods. Really, there's so many options for how to leverage cash plus because you already have a captured audience, you're giving them income security. How can you layer in other benefits for that also? But again, intentional design is critical. Social protection programs can have benefits on child marriage without even intending to, but when they are properly designed to do that, that's when you really see those gender responsive outcomes. A good example of this is in Mozambique, which is one of the global program countries. In Mozambique, they had a cash plus care pilot, and they found that in that cash plus care pilot, they had significant impacts actually on girls who were engaged in child marriage or at risk of child marriage, but that wasn't actually part of the design of the program, which it was very beneficial because it was a cash plus care component. So case management, training on caretaking, nutrition, etc. But what they found was they could actually expand those impacts even more if the design had been specifically intentionally looking at driving down rates of child marriage. So the last that I'll wrap us up here, just 2 slides remaining, is on one example, which is from the government of Benin. And I chose this as an example, hopefully most relevant for colleagues here from WAPAR, and something to think about that is actually a country outside of the global program, but a country that has seen significant and successful response due to a cash plus care component, so cash plus program. So it's important to note in Benin, 30% of girls are married before the age of 18. So a third of all girls in the country are still married before the age of 18. And what you see on the left-hand side are some of the interventions that were applied in this cash plus care program that was led in collaboration between child protection and social protection in country and was sponsored actually by the government of Finland. So they increased girls' ability to access integrated services. So that included child marriage prevention training, that included access to care services, etc. Specifically included school kits. Mona mentioned before that social protection can be a way of addressing some gaps or deficiencies a household might have. For example, they can't pay tuition, they can't pay for uniforms, they can't pay for school kits. Providing that can be a way to encourage them to keep their girls in school, for example. There was also community engagement of parents and religious leaders specifically in many communities, and the global program focuses heavily on this, who are the key influencers of social norms and gender norms around child marriage. They're very often religious leaders, elders in the community, etc. Even, for example, older generations of women in those communities. So actually engaging them as part of the cash plus elements for community sensitization, community training, and as influencing agents was very successful in Benin and has been in other contexts as well. And then social mobilization of adolescent girls and boys themselves. So actually training them around positive masculinities, for example, actually training them around what are the benefits of staying in school and not engaging in child marriage, so that they are also a voice and they have their own agency in their families to counter, for example, their parents in some cases who are pushing them into child marriage. Some of the lessons learned are what you see on the right-hand side. I'll just pick 2 of them. One is that cash can be used to keep girls in school with complementary components like school kits, to the example that Mona shared from Uganda, for example, and also to the example that Mona shared from Zambia. And then I'll also mention here that community sensitization and mobilization is key. So in Zambia, which is one of the strong examples of leveraging a social protection program for child marriage impacts, you see that through, for example, the Sustainable Women's Livelihoods Program, they were able to support women in engaging in livelihoods and use that as a platform for life skills training around topics like child marriage, ending gender-based violence, even ending violence against children, etc. So those can be key levers where you already have a captured audience and participants who are a part of these programs. And then the last slide here is what I'll leave you all with. And this slide is just saying that there are different ways that global program countries or other countries that are looking to drive down rates of child marriage really can work between child protection and social protection to do that. That includes coordinating with social protection colleagues who are actually specifically in touch and engaging with ministries of social protection and related ministries like the Ministry of Gender or Vulnerable Populations in many countries. Very often we might be talking to the same ministry, just different entry points, right? So some of this is about bringing that together. Something else is around collecting data, specifically having data on girls who are enrolled in social protection programs. So there are several countries, Egypt, for example, is another country outside of the global program, but that is able to use the data on households that are in the Tekeful and Karama national cash transfer program to identify who might be at risk of child marriage specifically, and then target interventions to them. It can also be used similarly for girls who are already married, because many times social registries include the ages of girls or any beneficiaries, as well as whether or not they're married, etc. So you can help identify households that way. And then the last thing I'll mention is working with social protection colleagues to incorporate reporting on child marriage, because in many cases it is such an underground movement, essentially, in some communities, especially where it's outlawed, that you need to have some sort of a grievance response mechanism, which exists in every social protection program, where households can actually report on incidents of child marriage. And we've actually seen girls themselves, in some cases, being able to report that they've been coerced or forced into child marriage through the social protection program. But if there's not a referral or linkage to child protection services, then sometimes those girls are still lost in the system, so to speak. But through all of this, you can create lasting impact for us. So that is the end of my presentation. Thank you very much for everyone here. If you're still in the Slido, it would be really great to hear from you whether or not you think that social protection can be leveraged in your country to address child marriage. And again, it's at the exact same link and code, but it would be really great to hear from you if you think this may be a response that's worthwhile in your country. Thank you very much for your attention, everyone. And I think I'm passing it over to our colleagues from Ethiopia.
Yes, thank you very much, Lauren, for a great presentation. And of course, thank you also to Mona for her earlier presentation. Mona, I see your hand up. Did you want to jump in? Or I think what we're going to do is wait until Getachew has finished. Getachew Kebede is going to present from Social Policy and UNICEF Ethiopia. Mona, did you want to jump in before that? Oh, you were clapping.
No.
Oh, okay.
Yeah,
Sorry about that. Isn't it
Yeah.
funny? It's the same as
Confusion.
kind of, it's like a Queen Elizabeth wave as well.
No, I was
Anyway.
clapping for Lauren. Thank you.
Okay. Thank you, Lauren.
Thank you so much. Thank you, Mona.
I have a number of questions, as I'm sure everyone else does, and I welcome you to please put them in the chat. Since we're running a little behind schedule, one option would be for presenters to respond in the chat as questions emerge, when and if that's possible. And if a question is too large to do so, we can engage in that when the group comes back together following Getachew's presentation. So without further ado, thank you and welcome to Getachew Kebede.
Hello?
Hi, Getachew.
Okay, so yeah, so sorry there was a delay. Anyway, good afternoon and good morning, depending on where you are. I am Getachew from UNICEF Ethiopia country office, and I'm social policy specialist working on social protection. So I don't think my video is working. Anyway, could I go ahead without video?
Absolutely, please go right ahead. We can see your slides, so that's great.
Thank you, thank you. Yeah, so I'm experience on contribution of PSNP on prevention of child marriage. As you all know, probably PSNP is a rural safety net program, which cover around 8 million people in more than 400 districts, almost half of the country.
I don't see your slides
yes,
anymore,
my slide is not
Getachew.
working, yeah?
Yeah, perhaps Emily could show them for you, and then you can just tell her when to switch the page.
Okay.
Yeah,
okay.
Is that an
Thank you for the
option?
support.
I can do that. Just give me 1 sec to get them up. Okay. Apologies, I just need to find them. I had them up a second ago. It's come back a touch. Did you want to carry on with yours then?
Yeah.
Yeah, if it happens again, I've got
let me try once.
Okay. Go ahead.
Yeah, it's working. Yeah, so my presentation will be structured in this way. I will, as I started, I will provide a brief on PSNP, and then I will talk about the link between PSNP and child marriage. I will provide some concrete example and finding, and I will mention potential challenge that we face related to ECM, and then I will come. I will also mention some of the recommendation. So as I started already, the program started in 2005, and the program transfer value is between $7 to $10 depending on the district wage rate. And the main aim, the current fifth phase of PSNP is to support household with extreme poverty. So the main aim is to reduce poverty. And by design, PSNP is not expected to contribute to reduction of child marriage, but I will talk about the link in this slide. So as I mentioned, PSNP is about contributing to poverty reduction, which, as you all know, also has impact on reducing child marriage. And PSNP also provided social behavioral change communication, in which one of the section, include child marriage and harmful traditional practices as main topic, and SPCC is mandatory as a part of public work. It's mandatory for all the client to attend SPCC sections. So among the six section, one of the section is related to ECM. And the program also provide cash plus approach in linking beneficiaries with education, nutrition, and other services. In some of the areas in PSNP district, there is also deployed social worker, which provide linkage to services, referral services, including child marriage. In terms of the impact of PSNP on child marriage, PSNP reduces financial burden of household, which some household uses marrying elders as a coping strategy. So the program contributed in the reducing this negative coping strategy of household. PSNP improved household financial status, which strengthens the demand for education, and reduces barrier for households to enroll their girls into a school. In terms of some of the evidence on PSNP on work allocation with household, some finding shows also work allocation with household, it has impact in reducing in some areas in girls spent on work as they focus on a school. As I mentioned, it has also a SPCC component, which is a mechanism to shift belief and gender norm related to girls' value in a society through interaction with community, and also through prevention of soft conditionalities. The other area, as I mentioned, is a community conversation on harmful traditional practice, also tackle community attitude around child marriage, which the finding, steady finding also proved it has impact in terms of reducing traditional practices. These are an example where our social worker be able to stop child marriage in one of the region in Ethiopia. So I don't go detail in terms of the case studies, but in general, just to mention some of the finding through qualitative study. Because of the PSNP SPCC section, people mentioned they are now sending their children into school rather than pushing them for marriage. So the girls are focusing on their education. This is one of the parents in Kamwarada finding show. And similarly, our social worker be able to stop around 199 child marriages in those 3 districts where UNICEF is piloting a cash plus approach. Other PSNP related finding, there was other finding which shows us PSNP also improve girls' grade, attainment and school efficiency. In East Hararghe, the finding, recent finding from Nicola and her colleague also shows the enrollment of girl benefit from PSNP is higher than those non-PSNP beneficiaries. Similarly, the other qualitative study also shows PSNP has impact on girls' education. The potential challenge and sometimes, social protection program may have also unintended impact or consequence. So the main challenge is PSNP is a complex program which involves, many donors and also many stakeholders from government side. So it's very difficult to influence, in the way which we believe as UNICEF. That's one of the challenge in terms of influencing and to bringing into PSNP to have a greater impact on child marriage. The other challenge was additional unintended impact of PSNP also found in some studies, which some of PSNP household be able to cover the cost of wedding and others because of the support from PSNP. These are in few areas. The other challenge was PSNP membership can increase, girls' prospect for receiving marriage. Some of in a few districts, it's found out that household who benefit from PSNP household are, be able to marry their kids early as PSNP is one of criteria in few districts of the country. This is not the entire country, but these are finding in few districts. The other challenge was a socio-economic gain. Sometimes, outweigh the child marriage. So some household, be able to do the early child marriage. In terms of the main recommendation from the different finding, PSNP with complementary program has a big potential impact in reducing child marriage through multiple pathways. So we need to make sure we provide complementary program like currently in the fifth phase, UNICEF be able to influence in having as one of SPCC section on child marriage, which we hope will have also a greater impact in reducing child marriage. The other main recommendation from different findings was additional cash plus component will be very important in preventing child marriage, as I mentioned, with SPCC plus livelihood and other kind of support. The other recommendation is economic strengthening a precondition for delaying child marriage from different findings, and it has also reduced the unintended effect of PSNP. So we need to make sure we enhance the livelihood of household in providing additional cash top up and other means. Education is a pathway in reducing child marriage, as we all know. So additional financial support to the poorest household combined with SPCC will have also greater impact in reducing child marriage. We find out in some of the districts the community mobilized resource for those households, and then they be able to provide them additional financial support to stop child marriage. So just to give you one example, in few areas they mobilize 2,000 bill, which will be in dollar maybe $40, and they provide to household, and that helps the household to stop child marriage and be able to buy school material for them to send girls into school. This was also demonstrated in some of the area where we do cash plus approach. As I mentioned, a complementary strategy in terms of changing belief attitude. That's also very important and come out in different study recommended in different kind of qualitative and quantitative finding. In terms of education, to have a positive impact on education, especially for girls, the recommendation was to enforce soft conditionalities and plus behavioral change communication, so it should include also education. And the current one, and the PSNP, as I mentioned, we have pharmaco traditional practice, other kind of nutrition related. but those recent finding which shows education should be also part of the SPCC section. The other area we could leverage is space and peace, providing transfer values very small, as I mentioned, it's less than $10. We can also leverage and provide small scale financial livelihood support in some of the district. We can test it as a pilot and we can scale up for a reduction of child marriage. So we can also use a platform, PSNP as a platform in terms of leveraging small scale financial support to some of households. I think these are the main recommendation from my side. I think over to you. Thank you for listening. And sorry also for the inconvenience in terms of my video and slide. Over to you.
Getachew, thank you very much for a great presentation with lots of information packed into it. I'm sure many of us have questions. I do as well. I want to, rather than taking the floor myself, I want to ask anyone in the audience today to please turn on their mic or put their hand up to ask any questions for Getachew or for Mona or for Lauren. We don't have many minutes left today, but we certainly have time for a few questions and we welcome you to ask them now. Thank you.
Colleagues, I've been trying to answer questions in the chat where possible. I hope I've addressed most of them, but please do let me know if not, and feel free to come on mic, as was just mentioned.
Thank you, Lauren. I see someone who is down as Amwale has her hand up. Please go ahead.
Thank you, Jessica. Hello.
Jillian.
Hello, Jillian. Yes. Yeah, so this is Alexander Male from Malawi, country office. I'm a child protection officer. And the discussion underway, trying to link ending child marriage and support from social protection, I think is an important one. Particularly from where from my role, I am also responsible for case management, child protection case management. And some of the observations are actually most of the observations are quite right, because when you go at a household and you look at the case management tools that we've used and you find the results and the indicators, you find that much of the challenges are a resource challenge at a household. And that's also what makes children to go back into marriages, because it's poverty that pushes them out of the household. And when you say, okay, we've dissolved this marriage, you go back to your household, they'll still find those challenges. So indeed, if these don't link, then our efforts may not actually bear the fruits that we all want to. But now my issue is, in addition to the discussion that we're having, is there any position that maybe the organization, when I talk about organization, I'm referring to UNICEF, that maybe there can be guidance on how this could be actually linked in addition to the lessons that we're learning? Because sometimes maybe not reference to any particular individual, but sometimes maybe the challenge could be individual, not as an organization. So if the organization can provide direction, maybe that can help. Over.
Lauren, would you like to jump in there, or Mona?
Did you want to take other questions? I see Danielle's hand is also
Sure.
up, but totally up to you.
Okay, thanks. Yes, sorry, my screen doesn't show everybody, but now I see Daniel Okello. Please jump in.
Thank you, Mona, and thank you, colleagues. Mine is related to the issue around the program management of all these kind of integrated multisectoral interventions. Are there some lessons that you would like to share with us, especially considering the fact that Cash Plus will always bring different sectors to work together? My experience has been that once we come together, there's a tendency again to slip back and work in silos, even when we're working with the same, stakeholders and beneficiaries, and the integrated nature kind of gets lost. So how have you been able to address some of this for those who have had practical experience out there in the field? Thank you. Over to you.
Thank you, Daniel. Shall we take one more question before we ask the presenters to respond? Or maybe while people are having a think, I can ask you, presenters, if you'd like to respond to those two questions. Thank you.
I'm happy to try to address part of those two questions. I don't add anything, especially on the last question, of some specific examples as well. But I think the first question that I believe Amwale was the colleague who raised that to ask in Malawi. I think it is actually something that we should think very critically about, especially going into this third phase of the global program, now that there is going to be kind of a key feature area around social protection as an instrument for child marriage. To my knowledge, as of right now, we do have some sort of top tips kinds of materials that have been created on how the two can be intersected, but we don't have any sort of concrete technical guidance specifically or recommendations that have been given to country offices. So I think that is something that we could absolutely look at, because I do agree that you're right, that sometimes there is the individual perspective that comes into play. And if a particular individual, say, doesn't see that this is an important issue or an important topic, et cetera, it can be easily kind of dismissed or difficult to engage in some of these conversations. So if there's a higher level of discussion that's happening around this and linkages, that's obviously always a very strong, encouraging agent. But I would say, at least from my perspective, I'd be very happy to work with global program colleagues or regional office colleagues to see how we can actually create some sort of guidance that might be useful at the country level, and that we could provide in that way as a set of recommendations, basically, on how to engage, why to engage, especially now that we have the latest data that's come out of the global program, including country profiles around some of the most pernicious, and these country profiles extend beyond the global program countries, but for where some of the most pernicious barriers are around child marriage, including on things like poverty. So I do think we have the material. We could definitely make something along these lines. If colleagues are interested, I'd be very happy to work with others to do something like that could be helpful. And then on the second question around program management and kind of multi-sectoral strategies and what does that look like, it is a difficult sort of hurdle when it comes to integrating some of these cash plus elements, especially in the country context where social protection, for example, and other elements of the cash plus aren't nestled in the same ministry. So some countries have had great success where you have social protection and child protection or vulnerable populations, et cetera, in the same ministry, social protection and gender in the same ministry. It tends to be a bit better and easier to coordinate some of these at national level, especially the cash plus elements. But when you have social protection with, say, the Ministry of Health, the Ministry of Education, most likely, and in most cases, where we've seen this work successfully is where there's an MOU that's actually created between those ministries. So for example, this was actually done in Rwanda. There's an MOU that stands between the Ministry that's responsible for social protection and the Ministry of Health for example, Mutuelle, which is access to the national health insurance scheme and health insurance services, and that actually does include responses for survivors of gender-based violence, including child marriage, for example. Another example maybe to bring, and I will say in the slides that I shared in the annex, there are actually several other examples that I didn't go through for the sake of time, but there's been similar efforts that have been done creating MOUs between sectors in a number of different countries, and some of them are even listed in there. Zambia is actually another one that's been really successful in this area, but I don't know if Mona might want to speak to that. And a few others. I can also drop some examples in the chat here as well. So it's not easy. It's not something that happens overnight, but the most successful strategies have leveraged either national action plans or MOUs between ministries to ensure that that linkage is sustained. And in some cases, that's even come from a higher level than just the ministries themselves. So it's come as an action at a policy level from presidential or prime ministerial level. In some cases, it's come as a directive from ministries of budget and planning as well, specifically finance, budgeting, and planning, which our social policy colleagues work with very often. And it's because these ministries are encouraging the multi-sectoral collaboration between ministries for resource allocation and distribution as well. So there are a number of examples, but I won't say that it's magic, it's easy, it happens overnight. And very often the role that UNICEF tends to play is actually piloting some of these approaches so that there is uptake across ministries, because we already work with different ministries, then we're able to better encourage that interministerial collaboration. But I'll pause there. I don't know if Mona had other things to add. And I think I see other hands and comments in the chat, so I'll try to answer this.
Well, thanks, Lauren. I think you've pretty much explained provided responses to those two questions very well. What I'll also say is that, and particularly for UNICEF child protection colleagues, we're looking at the system, right? System strengthening. And it is important, for child protection, for the first question, we need to leverage on internal expertise within our offices. So the social policy colleagues, I cannot overemphasize that. We need to work with them to see how best they can support us, even, doing the basic orientation of the existing social protection programs or cash plus programs that are in the country, cash and care, so that we know how and what needs to be put in place. We need to understand also when at the right, opportunities for us to also engage and influence the next design. I think, and going to the second question, how you design the program will really matter on the coordination of it, the challenges that we also face in ordinary, other programs when it comes to working with the other sectors, making sure that, all this is spelled out in the program document, and also, the coordination structures are in place and, work very well. One challenge I'll mention, which is, something that's ongoing, and maybe Lauren will come in later after we get the other questions, is that what we tend to also see, is that the social service workforce, they are the ones in most countries administering or, delivering the cash, doing the cash transfers at the household level. And so it is the same person who will also do the care part, whether it's case management, assess the household, provide the support the family may need. But at the same time, we have in East and Southern Africa, we don't have sufficient numbers of the workforce in place, especially the professional ones. We have very few of them. Estimations are showing like we have one professional social worker per 100,000, even in some countries more than 200,000 children, and they're responsible for many aspects of social welfare, from the elderly to persons with disability to children, and the list goes on. So we are also trying in East and Southern Africa. We're in the process, and my colleague Nicola Brandt is leading this work. We're going to be developing an investment case, starting off in Kenya and Zambia for the workforce, so that we can really have evidence to advocate for the need of having a sufficient number of the workforce, and also outline the challenges that they're facing. So I would say for the second question, when it comes to coordination, that's always a challenge, even in the other programs that we're managing. When more than one sector is involved, it will be challenging. However, these challenges can be overcome with regular communication, updates. If there are structures that people meet and come together, that also helps. And most importantly, the reports. So the social protection program will be accountable to report back to the donors or to the person's development partners supporting. And that's also another opportunity where this can be further strengthened and identified and discussed during the coordination meetings. Lauren, your hand is back up. Please come through. Thank you.
Yes, no, absolutely. And I think there was another colleague whose hand went up, but I was just that last point that you were mentioning, a social service workforce. Absolutely, absolutely. Social service workforce and social workers are overloaded, completely overloaded. And there's increasingly more and more responsibilities that have basically fallen on their shoulders without more bandwidth, without more capacity, without more funding in these spaces. And that last point, the investment case that you were just talking about for ISAR, I think is fantastic. Rwanda has actually been a trailblazer in this area and looking at the parasocial workers network basically across the country, and the fact that there are basically social workers who are assigned through so many different ministries for so many different functions at community level, including paid social workers, including community volunteers, etc. And what they actually did that was very successful was a mapping of all of these parasocial workers across multiple ministries. And to the second point that you mentioned, Mona, exactly, this was driven by the development partners. This was something that UNICEF and others advocated for to the World Bank, to FCDO, to others, and said this is critical to do this. And as a result of that, this mapping that they've done, they're now creating an integrated case management system, mimicking something we've seen in other countries, for example, in the MENA region, where there are a number of integrated case management systems, so that so much is not just on the shoulders of one particular social type of social worker, for example, so that you're linking to community health volunteers separately, you're linking to agricultural extension workers separately, etc., and bringing them into this networked approach. So it's something that they're moving forward with now. It's a strong example. So I just wanted to add that to what you said.
Thank you both very much. I see, Alexander, your hand is back up. I just wanted to check in with people. We're a couple of minutes over time at the moment, and I just wanted to see if people wanted to stay online for 5 more minutes to continue the conversation, or what works. I know we have the kind interpreters here helping as well, so I don't want to go over time. Perhaps we'll take one more question and then we'll wrap it up. Is there, let me just take a look here. Alexander, did you want to jump in?
No, but just to say, I didn't raise my hand, but just maybe one comment is that it seems in other country offices there is a child protection case management, and then there is also other ways of identifying people to be on social protection, and there is also a case management kind of. Now, if you have two things that maybe you've put your energies, your intelligence in it, your skills, and then just that thing, just to say, okay, maybe we do this, it's not as easy. That's why my question was, will there be any direction to that effect, just to ensure that, because these are mutually reinforcing, you do the assessment, and then somebody does something, and then you bring them together. I'm still, just like Iro said, I agree with the team that if somebody moved out of the household because of the challenges goes into a marriage, if we are to allow that person to stay, then there should be these challenges, these push factors have to be addressed. And I think the cash part is very important.
Thank you very much.
May I come in? Yeah, it was my hand,
Denise.
maybe Denise. Yeah, thank you.
Bienvenue.
Yeah, a quick comment, especially that Ronen has mentioned about Rwanda. Basically, throughout the presentation, what was going in my mind was like the struggle, how really, from the child protection and social protection, we are trying hard really to work together, especially on the specific thing. Especially for us, we have, in this case, we'll talk about the teen adolescent pregnancies, but also for the social care in general. It is really very nascent, and we need to knock always on the door of our colleagues in child protection to remind them, we are there, this agenda is there, and when it's a meeting, please inform us. And now we have managed at least to be co-chairing one of the sub-cluster meeting at the national level on the social care. At least that is becoming an entry point. But just to emphasize that, as other presenter and colleagues have commented, it's not really something that will happen overnight. It will need to be deliberate, and especially it will need from us in child protection to stand up and really go connect with our colleagues in social protection. So that is happening within UNICEF, but at the same time, from the ministries, because we have the Ministry of Social Protection, which is Minalog, and we have Mission Prof, which hosts child protection. But you will find even with UNICEF, within UNICEF, we may be pushing, and our colleagues, we are working together, but our counterpart in the ministry might not necessarily be putting the same level of the effort to go work together with their counterpart in social protection. So it needs really a lot of effort, pulling from here, from there, and bringing everyone together and be intentional in that process. So that's what I really wanted to add on that journey. Over. Thank you.
Thank you, Denise and Alexander. I see some other hands up, but I'm afraid we're going to have to wrap up. I wanted to thank everyone and to pass the mic very quickly to our colleague Catherine Mueller in Dakar, or maybe to Mona. I think it may be Mona who's wrapping up.
Sure. Thank you. Thank you so much, Gillian and dear participants. I think this has been a very lively and very engaging webinar. We have learned a lot based on what is available in terms of implementation. And of course, we note all the very good questions and comments that have been shared. And we will definitely see how best to support you, and maybe to link you with some of the other countries that have managed to put this into practice so that you can learn more on the how to. But I think the key message there that Dennis also highlighted to, in her intervention is the need for us, child protection and those who are social policy from the UNICEF who are present here today, how best can we work together? How can we foster that good work relationship so that you in child protection understands what the social policy agenda is, what the social protection program, the national social protection program is all about, where you can be comfortable to talk about it. We need to equip ourselves with the knowledge and also eventually the skill sets that are required so that we can better integrate and advance the child protection agenda. Right now, we're focusing on ending child marriage. How can we ensure that we move this forward? So with that, this marks really the end of the webinar. Many thanks to Child Frontiers, Gillian, Emily, and Bertha, and many other, the rest of the consultants for organizing and doing the coordination of this webinar. Many thanks to my counterpart in Wakaro, Catherine, who started off, to set the scene and for us to start this webinar, and to the presenters, Lorraine, it's always wonderful to hear your interventions. I met you first in South Africa, in Johannesburg, at the Global Program to End Child Marriage meeting to design the phase 3 of the program. And of course, very impressive to get the insights and also updates of what's going on globally, when it comes to social protection and how best we can advance the agenda. Just to mention that we have a newsletter, something that Catherine mentioned at the beginning. So if you haven't yet subscribed for the newsletter, click that link. That's going to be reposted again, and has been reposted again in the chat box. Click that so that you get direct information, updates to your email. That's important. And the next webinar, we note that this is the summer period. The next webinar is going to be around September or maybe October. This is going to be confirmed, subject to availability of the speakers that we have planned. And the webinar is going to be on child marriage in the conflict of climate change. So another very interesting topic and very relevant to all of us. To be on child marriage in the context of conflict and climate change. Very interesting research also happening in this region that will be shared, and many other interesting and insightful progress made in this area will be shared during this webinar. And of course, through the newsletter, once you have subscribed, you will get all these updates direct into your email. Otherwise, if you haven't subscribed to the newsletter, what Catherine and myself will do is to forward it to you, through the UNICEF email network mailing address, so that you are aware of what's happening. So with that, I thank you all very much. Thank you for the energy, for your participation, and have a good rest of the day. Goodbye for now.